Good morning. This video is going to demonstrate the use of the Tracstar LDP guide from imperative care in coil embolization of ruptured bilateral pcomm aneurysms. The patient is an elderly female who was transferred to our institution from across the border that initially presented with a subarachnoid hemorrhage, Hunt's grade 4, Fisher grade 3. She was found on non-invasive imaging to have harbored bilateral posterior communicating artery aneurysms. The patient was subsequently taken to cath lab, where she underwent angiography that demonstrated a flame-shaped right posterior communicating artery aneurysm measuring 4.6 millimeters by 2.6 millimeters with a 1.5 millimeter neck. Given her age and clinical status, we elected to treat this aneurysm endovascular. This slide demonstrates the use of the Tracstar guide, which is currently positioned in the lacerum segment of the right internal carotid artery for coil embolization. You can see the septal balloon is parked in the proximal M1 segment, while our headway 17 coiling microcatheter is located within the dome of the aneurysm. After the framing coil was situated nicely in the aneurysm, a follow-up run was performed and the coil was detached. In this subsequent run, we can see that the second coil appears to actually herniate into the parent vessel. Multiple attempts were made to position the second coil. However, ultimately, we required the use of temporary balloon inflation to coax the second coil into the aneurysm. The lack of an intermediate catheter also provides a good amount of space to perform good runs through the Tracstar guide. The left posterior communicating artery aneurysm, which measured 2.8 by 2.6 millimeters, was treated also in a similar fashion with balloon-assisted coiling, but as you can see in the subsequent runs, the balloon was not actually utilized.